Good afternoon, everybody. It's March 26, 2021. I'm Gary Pace, Public Health Officer for Lake County. And this is the COVID-19 response for Lake County update. So at this point, we've been having significant drop in cases over the last couple months. Over the last week, that has stopped, and it's actually starting to rise a little bit this week. We don't know whether this is just a momentary jump in cases or whether this is the beginning of a new trend, but we're definitely seeing something a little bit different, and I'll show you on the slides here. Sarah is not going to be able to help us today, so I'll do it by myself here. We are still in the red tier, and that all seems okay, although the new rise in cases kind of momentarily puts us out of the red tier, but that shouldn't be a big problem at this point. And we are continuing to roll out the vaccines as fast as we can here. So let's go to the data. So this is some of the data from California overall. On the left is the total tests that are being done. So they're continuing to drop a little bit, but it's still a pretty good number of testing. The positivity rate on the right side, this is in California, is 1.9%, which is quite low. It's the lowest it's been in the whole pandemic. This is the next slide of California again. On the left side is confirmed cases, and you can see that this is continuing to drop. It looks good in this slide. On the slide on the right is the total confirmed deaths, and this is very low now, the lowest it's been for a long, long time. So it's very nice to see that. This is the tiers in California. So you can see that the state is looking pretty much red at this point, with a few purple counties in the middle there in the Central Valley, and then we're starting to see more counties that are moving into the orange. We are on the left side here, you can see that our daily case rate is now 6.6 per 100,000, and the testing positivity is 4.2%, which is almost double is double what it is statewide right now. So this is the one I want to spend a little bit of time on. This is the Epicurve, where we can really follow the number of cases in Lake County. So this is Lake County data now. And you can see back in early January, we got this really high number of 300 cases a week. And then we've been dropping consistently down, and we were getting down around 30 to 35 cases the last couple of weeks. Now this last week that started March 14th, and we're still getting cases coming in from that, it's now jumped up again to 47. We've looked at it a little bit, and there doesn't seem to be a clear pattern at this point. So we just don't know right now whether this is just a momentary surge and it'll go back down, or whether this is going to be the beginning of another upward climb. So we're going to have to see. Certainly within the last couple of weeks, we moved into the red, and we're starting to see more activity, more indoor dining in restaurants and things like that. We don't know what the connection is between all that now. There are also some thoughts that there could be variants involved in this. We don't know that. We did get some information back on variants recently from the state, but the data is a couple months old, and the only thing we saw was this West Coast variant, 1427 and 1429, which we already knew were around here. So there's not any new information on that. The last slide today is about the vaccinations, and this is a very interesting slide that Sarah's put together. So we have now basically 1 in 3 of all people 16 years and older are partially or fully vaccinated. So they've gotten at least one dose. The way she's got this set up is this brownish color is people that have gotten just one dose or are partially vaccinated now. The yellow color is the people that have that are fully vaccinated now. That's 18%. So 30% total with this data. And this does not include the tribal health data, which is another 1,000 or so people. So it really puts us up to about 33% of everybody 16 and older have gotten vaccinated, at least one dose. If you look down in the lower right here, this is also very interesting, where 2/3 of everybody 75 and older have gotten at least one dose, and 60% of all the people 65 to 74 have gotten one dose. So this is actually really good, because this shows that The most vulnerable people have been getting vaccinated, which is what we were very interested in. And so that if we do start seeing a rise like we're starting to see now, this continues to rise, we should not get into the same situation we were in January, where more people were dying, the hospitals were getting filled up, people were getting pretty sick. That we're hoping that this vaccination rate that we're seeing here is going to be protective of that. So even if the cases do climb, and some people will be getting sick, but the most vulnerable people and the people that are most at risk of getting very severe outcomes are hopefully are vaccinated. And also the fact that a third of the population is vaccinated at this point is going to slow down the transmission and the spread around the community. The other piece of data that has come out recently is that it looks like about 30% of the population in Northern California, we don't have it county by county, is showing antibodies to the virus, so which indicates that that number of people has been infected in the past. So probably about a third has been infected, about a third have been vaccinated now, at least partially, and there's going to be some overlap. So there's something like 40 to 50% probably of people that have pretty good immunity at this point. So that's going to definitely slow down the virus from spreading the way we were concerned about. So again, we're in the red tier. We're going to need to stay in it for a minimum of 3 weeks. This is 2 weeks now. And so we're not in the orange data yet. So we have at least 2 more weeks and probably longer than that, especially with this rise in cases. The vaccine. So there's a lot going on. As always, there's a lot of changes, and it's very confusing, and I'm sure people are really frustrated about this. But the governor just came out earlier today and said that starting next Thursday on April 1st, people 50 years old and older will be eligible. So this is going to open it up a lot more to anybody 50 and older is going to be able to get vaccinated starting next Thursday, the 1st. And starting the 15th of April, basically is opening it up to everybody 16 and older. So we're just going to have 2 weeks then where the folks at 50 to 64 can get in the front of the line. The appointments have been challenging to get. We are now on the MyTurn system, so people can get appointments at myturn.ca.gov, or if you can't, track that down, go onto our website. There is also a phone line that MyTurn has, or that you can talk to our folks at the phone line in the county, and they can help you do it. But what happens is we're only opening them up a few days at a time still, but that's going to be changing here real quickly. We'll probably be able to open it in a couple of weeks at a time here very, very shortly. But because we just made this switch over and there were some bumps in the road, we've only been able to open it a little bit at a time. But this is first doses and second doses. Both of those people will get their appointments on the MyTurn website. That's the way it is moving forward. And but if you try to get on and it says there's no appointments, just go ahead and try back again the next day, because we're having to just open it up a couple days at a time right now until we get everything straightened out. Also, Adventist is doing a lot of vaccines now, and they're opening up to the community. So if you're a patient at Adventist or a community member, you can call up there and get appointments. Sutter is also going to start doing it again next week. And the same thing, the Sutter patients or community members. Tribal Health is doing a lot of vaccines. They're doing a great job. And starting April 1st, I think they're going to start opening up to the community at large as well. And a couple of the pharmacies, Safeway Pharmacy and Northlake Pharmacy, are both doing vaccinations as well. So those are all the different sites in the county where you can get it. We're hoping that more and more vaccine is going to be coming in the coming weeks. And so the spigot is going to open up even more so that people will have pretty good access. The sites are the same sites now. We're doing 1 day a week at Lakeport at the Drive-In Theater, and Tuesday, Wednesday, Thursday at Redbud Park in Clear Lake. So If you're having trouble getting into one of those sites and you're eligible and you're having just getting frustrated, give us a call and we'll see if we can help you. If you have a second doses and you're having trouble getting in, just keep trying. If it's starting to get past your date, don't worry. It's okay to go at least a couple weeks after the date that you're due, but give us a call and we'll try to get you in. We don't want you to get real frustrated out there. And we know with all these changes, it's hard to keep up with it. So all in all, things are looking okay. We're a little bit concerned because of this rise in cases, and but I really don't think it's going to be like it was before. So we still really want to caution people to be careful out there. Wear your masks. Don't gather with a bunch of people because it's the virus is still very much present, and some of these variants are floating around out there. So if you're not vaccinated, you want to be really careful. If you are vaccinated, it's still a good idea to wear the mask, but you can be a lot less worried about what the outcome's going to be. And I just can't encourage people enough to go ahead and get vaccinated as soon as you can. We've had a lot of open appointments the last couple of weeks, and I think it's partly because of just the computer problems and getting all the appointments together. But we really think that it's a very good thing to get going. We're not seeing a whole lot of bad side effects, and it's we're going to be able to be a lot quicker moving into regular life if people get vaccinated more and more. We just get a lot more immunity out in the community. So that's all for now. One thing I did want to say is this will be the last time we do a Thursday video like this. We'll continue to do them on Tuesdays, either at the Board of Supervisor meeting or like next week, there's not a Board of Supervisor meeting. So we'll go ahead and put a video out that day, but we won't be doing it on Thursdays anymore. There's just not that many people looking at it. And we also put out a press release on Thursday or Friday morning. So any information is going out like that. We can always change this if we need to, but that's kind of the plan going forward. So thank you very much. And I really hope everybody can stay safe out there. Thank you.